Today we're going to be going through the thyroid ultrasound exam. I'm going to be talking about the protocol that we use at our institution, some pathology that we have images on, and the report that we would be using. And I'm also going to go into a little bit about TIRADS and how we would classify or put a point for any pathology that is seen. So first we're going to be going through the protocol. The protocol is shown here. So first we would go into the transverse plane of the thyroid, showing the right and left lobes using the trapezoid view, so we can fit all of the thyroid into the image. And then we're gonna put color on this image. Then we are gonna take an image of the isthmus, which is where the right and left lobes connect in the middle. And we're gonna put a measurement on there, measuring from anterior to posterior. And we're also gonna put a color on that. Then we are going to show the right thyroid lobe in a transverse view, and we're going to measure the width on this image. And we're also going to put color just to see if there's any abnormal vascularity. Then we are going to do a sweep from superior to inferior. Then we're going to take a sagittal view image of the right thyroid lobe. Then we are going to measure the length and the height of the thyroid lobe. We're also going to put color on this image, and we are going to sweep from lateral to medial. And we're going to image any masses or nodules seen in the thyroid lobes, and we're going to put measurements, color. Then we're going to move on to the right mandibular gland, get an image of that, and we're going to put color. Then it is the right parotid gland. Again, we're going to get an image and with color. Then we're going to move on to the neck levels. Some places want you to image neck level 1, and some places want you to start at neck level 2 to 4. And you're going to image any lymph nodes or masses seen. And if you see any pathology, then you're going to put color. You're going to measure in both sag and transverse. Then you move on to the left side, again doing transverse thyroid lobe, getting color, sweeps. Then the sagittal thyroid lobe, measure, color, sweeps, note any nodules. the left submandibular gland with and without color, the left parotid gland with and without color, and the neck levels either from 1 to 4 or 2 to 4 with any lymph nodes noted, color, measurements. And that's it for the protocol. Next, I'm going to show a couple more images following the same protocol. These images are going to have more pathology. Starting off again with the transverse image of the right and left thyroid lobes, putting color, showing an image of the isthmus, the measurement, the color, then going on to the right thyroid lobe in transverse, putting a measurement of the width, showing color, and doing a sweep from superior to inferior. And notice that there are a couple structures seen in the thyroid. And I'm just showing the structures seen, hypoechoic with an echogenic foci. Then putting measurements on them and showing them with color. Showing a sagittal image of the right lobe and putting a measurement on there of the length and the height, putting color on and doing a sweep from lateral to medial. Then moving on to the submandibular area, and you can already tell that there's a lymph node showing. So we put color on the submandibular and then focus on the lymph node and image it in a transverse and sagittal plane, put color and measure. Then we move on to the parotid area, putting color, and notice the hypoechoic area that seems to be a lymph node or suspicious of a lymph node. So we put measurements on there and we put color. Then we move on to the neck levels, and there's a lymph node there. And this is an area that the patient noticed that there is a lump. So this area is under the chin, and it seems to be a lymph node. We're suspicious of a lymph node. We put measurements on there, color, and if there seems to be color within, then we go ahead and pulse wave it. Next, we are moving on to the left lobe of the thyroid. Again, in transverse, getting the width measurement, putting color on there. And doing a sweep from superior to inferior. Notice that there's a couple more structures on the left side. We measure them, put color on there. Then we get a sagittal view of the thyroid, putting a measurement on there, the length and the height. And then we put color and do a sweep from medial to lateral. And image the submandibular area. Put color on there. We noticed a lymph node in that area as well, so we measure it, put color. Then we move on to the parotid area, which also has a lymph node. So we put color on there and we measure it. we go on to the neck levels. And we notice at level 3 there is a lymph node, so we measure that and we put color. And that is the end of the exam.
Scoring nodules using TIRAD's point system. There are 5 categories, and under each category, depending on how the nodule looks, is how many points it gets. Category 1 being composition. If it is cystic, it's 0 points, spongiform 0 points, mixed, cystic, or solid is 1 point, solid is 2 points. Category number 2 is echogenicity. If it is anechoic, it's 0 points, hyper or isoechoic 1 point, hypoechoic 2 points, very hypoechoic 3 points. Category 3 is shape. If it is wider than tall, it is 0 points, taller than wide is 3 points. Category 4 is margin. Smooth 0, ill-defined 0, lobulated or irregular is 2 points, extrathyroidal extension is 3 points. 5th category is echogenic foci. If there is none or large comet tail artifacts is 0 points, macro calcification 1 point, peripheral rim calcification is 2 points, punctate echogenic foci is 3 points. After getting the points from each category, they are added up, and depending on the score, it will tell you if it is benign or highly suspicious. TIRAD level 1 being 0 points means it is benign and no fine needle aspiration is needed. TIRAD 2 means there is 2 points, which is not suspicious and no fine needle aspiration is needed. TIRAD level 3 is mildly suspicious with 3 points. A fine needle aspiration will be needed if it is greater than 2.5 centimeters. A follow-up will be needed if it is greater than 1.5 centimeters. TIRAD level 4 is moderately suspicious with 4 to 6 points. A fine needle aspiration will be needed if it is greater than 1.5 centimeters. And TIRAD level 5 with 7 points or more means it is highly suspicious, and a fine needle aspiration will be needed if it is greater than 1 centimeter. The following nodules are classified under composition: cystic with 0 points, echogenicity as hypoechoic with 2 points, shape is wider than tall with 0 points. Margin is smooth with 0 points, and they have punctate echogenic foci with 3 points, adding up to 5 points, considering it TIRAD level 4, which is moderately suspicious. Fine needle aspiration will be needed if it is greater than 1.5 centimeters. A follow-up will be needed if it is greater than 1 centimeter. When writing a report, the first thing you do is write patient's age and whether they are male or female. Under that goes the diagnosis, and under that goes the type of exam you're doing. After that, you write down each structure that you scanned, and if you see anything at any structure, you would describe the pathology or the structure that you see, whether it's homogeneous, echogenic, etc. You would describe if there was vascularity or no vascularity. You would write down the measurements, and you would write down, if you did a pulse wave, the type of waveform there was. For example, on this report, it is a 23-year-old female, a diagnosis as hyperthyroidism, and it was a thyroid exam. We wrote down the isthmus, and for the isthmus, we put homogeneous, no solid cystic structure seen, and no hypervascularity noted. After that, we put right lobe, right submand, right parotid, left submand, left parotid, right neck levels, left neck levels, submand/neck levels, and described each level and added if there was pathology or no pathology, added measurements, and added if there was vascularity or no vascularity. Once you are done typing, describing, if you saw anything, you would write not an official report, including your credentials, and send it out to the radiologist. The reason why you describe, if you see any structure, the radiologist come up with a diagnosis. They will look at your report and review with the images